Hey guys, today we will learn about the hip bone. At first, we have to identify which sided hip bone. How can we identify this? By seeing the bone at the acetabulum, which lies laterally, and then the anterior superiliac spine and the pubis tubercle lies in the same vertical plane, and then the obturator foramen lies below the acetabulum, and this is the iliac bone, which lies superiorly, and the pubis tubercle, which lies anteromedially. You can see that it lies anteromedially, while the ischium tuberosity lies posterior laterally, and it is the lowest point. We have identified it is the left-sided hip bone. Now, how it is formed? It is formed by the join of the three bones, which is ilium, pubis, and ischium. It is joined in the acetabulum at the y-shaped manner, where the 2/5 is ilium, 2/5 is ischium, and the 1/5 is pubis. Now we will learn about this ilium bone. It has three surfaces: iliac fossa, sacropelvic surface, where the sacrum bone is attached, and then the backward posteriorly gluteal surface. And it has two ends, upper end and lower end, and four borders, which is anterior border, superior border, posterior border, and then the medial border. Now let's learn about the attachment of the iliac bone. At first, in the anterior superiliac spine, there is the attachment of inguinal ligament and then the sartorius muscle. In the anterior inferior iliac spine, there is the attachment of straight head of rectus femoris. In the posterior superior iliac spine, there is the attachment of sacrotubercle ligament, while in the iliac fossa, there is the attachment of iliacus muscle. In the iliac crest, which is the upper superior border of the iliacus, there is three lips: outer lip, middle lip, and inner lip. At the outer lip also, it is divided into the anterior 2/3 portion and a posterior 1/3 portion. In the anterior 2/3 portion, from outer to inner lip, there is the attachment of external oblique muscle, internal oblique muscle, and transverse abdominalis. While in the posterior lip, in the outer lip, there is the attachment of the gluteus maximus, and then in the inner lip, there is the attachment of erector spinous muscle. Now we learn about the gluteal surface. In the gluteal surface, there is the attachment of three muscles. In the anterior, there is the attachment of the gluteus minimus. In the middle portion, there is the attachment of that muscle gluteus medius, and at the posterior end, there is the attachment of gluteus maximus muscle, which is the chief extensor of the hip joint. We have completed iliac bone. Now let's move to the greater sciatic notch. This is greater sciatic notch, which is formed by the posterior inferior iliac spine and the ischial spine. In the living being, when the person is alive, there is the greater sciatic foramen, which is formed by the sacrotuberous ligament and then the sacrospinous ligament. From the greater sciatic notch, we have to study about the structure that is passing through the greater sciatic notch. In the greater sciatic notch, there is the presence of the piriformis muscle. Above the piriformis muscle, superior gluteal vessels and nerves passes through, while from below the piriformis muscle, there is the inferior gluteal nerves and vessels, sciatic nerve, and then pudendal nerve, internal pudendal vessel passes through it. Now we will learn about the pubis bone. It is 1/5 of the total hip bone. It has three parts, which is superior pubic crest, body, and then inferior pubic crest. Now we will learn about the attachment of pubic bone. At the outer lip, there is the attachment of the pectinatus muscle in the superior pubic crest, while in the body, there is the attachment of the adductor longus muscle. Just below the adductor longus muscle, there is the attachment of gracialis muscle. Now about the obturator foramen. From the obturator foramen, the obturator nerves and vessels passes through it. In the internal surface, there is the attachment of the obturator internus muscle along with the border of the obturator foramen, which goes up to the medial border of the ilium, while in the external surface, there is the attachment of obturator externus muscle. Now we will learn about the ischium bone. It has the ischial tuberosity, body, and ramus of ischium. What is the importance of ischial tuberosity? It is asked in VIVA. The main importance is all the hamstring muscle are origin from the ischial tuberosity, and the attachment of the ischial tuberosity is also the hamstring muscle, which are semitendinous, semimembranous, adductor magnus sorted. This is the acetabulum, which lies laterally. In the acetabulum, the head of the femur is attached and form the hip joint, and the rectus femoris muscle just lies above the acetabulum in the middle border of the iliac bone. Now we learn to how to differentiate it is male hip bone or the female hip bone. At first, the greater sciatic notch. It is 75 degree in the female while 50 degree or less in the male, and then the obturator foramen. In the obturator foramen, in female it is triangular in shape, or in male it is oval in shape, and the ischial spine. It is inverted in male while everted in female, and the iliac surface. It is shallow in female while deep in male. And the main difference is the distance between the anterior margin of the acetabulum to the pubis tubercle is less than the transverse diameter of the acetabulum in female, while equal or more in male. This is all about the hip bone that is required for the VIVA.